Hi, everyone. First of all, I would like to say thank you for the sessions and also the company classes to host this webinar for me. And I'm so sorry that I think there is miscommunication about the time of the webinar and sessions. But from now, we will take over for 1 hour. So my talk will be pretty much around 40 to 45 minutes, and I will leave 15 minutes, last 15 minutes for Q&A. And today I would like to present to you all the efficacy of macro focus ultrasound in the treatment of upper facial laxity. Actually, I will go over with all other indication of Ultraformer 3 as well, but the reason why I got invited to give this talk is because my recent publication that has been published last year during the pandemic. But before so, I would like to disclose that the place where I work, I got research grant and also sometimes equipment loan from all other energy-based device company, and some of them involved with facial contouring and also body contouring. This is the study that I has mentioned to you earlier. This has been published in Journal of Cosmetic Dermatology last year. And during conducting these studies, I received support by borrowing the device from Quantum Thailand, the distributor of Ultraformer 3 in Thailand. Before I'm going on to the technologies, I would like to mention that facial laxity and wrinkles is actually the common aesthetic problems. In 2009, the first microfocus ultrasound with visualization was approved by US FDA for brow lift. But you know, since then, we utilize all the function and all the technology of microfocus ultrasound, or some people might call high intensity focus ultrasound or HIFU, for 10 years. But now Ultraformer has also introduced the new macrofocus ultrasound. Ultraformer used to provide microfocus ultrasound earlier. And I think this handpiece is this transducer is very interesting. I will tell you afterwards. Before going on, let me recap you all the technology of micro and macro focus ultrasound of Ultraformer. Ultrasound is actually the sound at the frequency that higher than can be detected by human ear. So which means we will not hear any of that sound, but there is actually a sound. And you can see that, you know, we divide it into low frequency and high frequency. And the high frequency wise here, it divided at pretty much around 1 megahertz, and high frequency ultrasound that can be used for the healthcare service. And you can see we start using physical therapy. You know, the low frequency, we use it for cleaner and cleaning, we use it in industrial. But the higher, the more efficacy it is. The reason is here. If you can see, the frequency of the ultrasound is determine the rate of the energy absorbed. And what you need from ultrasound to make your face or your body tighten is heated or energy. And you can see that the higher the frequency, which means the shorter the wavelength. And when you have shorter wavelength, you will get less penetration. Less penetration in the skin on the face, it's not mean bad. You know, when you want to use ultrasound to take a look in your abdomen or in your body, you need something that can, that longer wavelength and then absorption into the belly. So which means for the skin wise, you need something that has less penetration. So that is what you need, high frequency ultrasound. And it also causes high absorption in the skin. So the energy that provide and, you know, stimulate by all ultrasound will be very superficial on our skin and have the effect only on the dermis or superficial or deep dermis, or sometimes we can stimulate even SMES. So I think that is considered the benefit of high frequency ultrasound. Again, you can see that the higher frequency, the more efficacy that you can use. Our therapy, the very first gold standard and the model, the frequency is at 4 to 7 megahertz. After frequency, you need to look at the mechanism of action. There is two types of ultrasound, focus and non-focus. If you want to do something to your skin and have the target superficially, you need focus ultrasound to make things work. If you are using non-focus ultrasound, the intensity will be decreased with distance, so which means all the energy of ultrasound will be only at the contact point. But if you are using focus transducer, the energy will go deep to the distance where you need it at the focal area, and you might see here. That is why we have different transducer to target different depth from the skin, 1.5 to 3.0 and 4.5. So that is how we can use the focus transducer to utilize the energy to the target. Why do we talking about the all energy? Because we want to make sure that the energy and the temperature higher enough to cause the lifting, because all we need is the lifting. So which means what you need is to deliver the target tissue at 60 to 70 degrees Celsius. And the only machine that can go, the only ultrasound that can increase the temperature of the collagen that high is focus ultrasound. And the good thing about using focus ultrasound is it will not damage the surrounding area. So it's very particular and specific to target the depth that you need. So that is why the depth matters. Depth is very important. When you heat the area or you already perform high intensity focus ultrasound treatment, what you cause to the skin is you can get skin coagulation, and inflammation process might occur at 2 days. And then granulation tissue, wound contraction, and proliferation phase, which can occur from day 2 to 6 weeks. And then afterwards, which is something that we need, is collagen rearrangement and remodeling that can create lifting effects. So which start after 3 weeks. This is one thing that you need to tell your patient that, you have to wait remodeling to occur, or else, you cannot really determine the effects from seeing it immediately, because that is all information. But what you need is collagen stimulation and its long-term effects. Again, after wound healings, you need skin to remodeling and realign. That is why the other key is you need to really heat the skin to the temperature that we mentioned, 60 to 70 degrees, and you have to wait. That is why all the clinical study that has been done, we suggest to follow the patient up to 3 months or 6 months to see the maximum effect of collagen remodeling. Let's get back to our machine here. So this is, as I mentioned, the focus ultrasound. And, we have two types now, macro or micro. I will mention again. So micro is small dot, macro is big dot. The difference between small and big is here. So macro focus ultrasound or macro focus mode will provide 8 times bigger. So, comparing to the size of the energy. So we can call it TCP or thermal zone. So you can see that with macro focus ultrasound is very small, and micro focus is small, but macro, the energy ball is bigger. So which means it stimulates collagen even more. You have different transducer and at different depth for micro and macro focus. And what you can see is, this is my favorite transducer, which is macro focus at 2 mm. Why? I think with macro focus, you get the energy tissue the treated area is 8 times bigger when comparing to micro focus. And the depth wise is 2 mm, which, like the gold standard, our therapy has no 2 mm depth. So this is the differentiation things from the Ultraformer. And again, when comparing between microfocus ultrasound mode of Ultraformer and Althera, I think it's pretty much at the same size. And you can see this is 1.8 mm in shape when you are looking like two-dimensional. This is when we're talking about phase. So, as I told you earlier, that this is micro focus ultrasound and 2 mm is macro focus ultrasound. So that is why, we just recently get the new and upgrading with the compact design. It's easy for using and the dot is bigger. So which means you treat the skin in larger area when comparing to micro focus. And uh, the company is actually suggests multiple indication, but what I want to study now is the eyebrow lifting, which I did first, and then I published the study in Journal of Cosmetic Dermatology, as I mentioned. The good thing about uh, MF2 is it's easy to access because of the small transducer, so it can go anywhere in the small area, and faster, and also it's economically running cost. So there is consumable cost, but it's cheaper. So the first study that I has been done and used the MF2 or 2mm transducer is the study that has already been published. What we did is it's a prospective study. I recruit all 34 Thai patients, age ranging between 30 to 50 years old, and all patients get only one single treatment of macrofocus ultrasound device. This is the protocol that we treat the patient, just use only 2mm transducer. The total line is 90 horizontal line. Let me show you the photo. That might be better. So this is the recommended protocol from the company. But actually, when we treat the patient, we use even less amount of line. So at the crow's feet, I use just only like 10 lines per side. And again, under eyes, even they suggest 30 lines. I just use only like 15 lines. So it's actually less than what the company recommends. And this is the average the demographic data of the patient. And let me show you here, pain score is 3. So which means a patient is able to tolerate the pain. Even so, I asked the patient to put the numbing cream on for 1 hour, and the pain is still tolerable. We evaluate the patient by using the image analysis software to measure the eyebrow height. And also we use 3-dimensional camera to capture the facial volume that has been changed. And also we measure wrinkles, skin roughness, and melanin concentration. Let me show you this result here. This is the photo that has been published in the studies. So if you want to get the publication, you can ask your sales rep in your area or your country. They will distribute all these manuscript to you. And you can see that, you start seeing the eyebrow lifting maximum at 3 months, and then it stay. At 6 months, it's a bit down, like, going downward, but, still better than baseline. And when I put these on, and you can see the lifting effect is just right there up until 6 months. This is the examples of another patients that is using. Another patients in the studies. So by measuring it, and you can see that significant lifting of eyebrow, you can start seeing as early as 1 week after treatment, and it stays significant lifting up until 6 months. And I feel regret that I followed the patient up just only 6 months. I think I would like to know more if it stay up until a year or not. Volume measurement is not difficult. I think it's because, this is not the volume changing, but it's just only the lifting. So we did not really see any difference. But the wrinkles wise, if you wait 6 months, you can start seeing. I think the improvement at 1 week is just only inflammation. But, you need to wait for collagen stimulation. And you can see, again, a significant wrinkle reduction at 6 months, measuring by Anthera 3-dimensional. Skin roughness, again, you need collagen stimulation, so you can see something change at 6 months. Lastly, the melanin index. Unfortunately, we don't see anything from melanin, and I don't expect to see melanin changing or skin whitening. So I think this machine is just for lifting. It's not the whitening or lightening machine. This is the improvement measure rating by patients. And you can see most of the patients see the result still up until 6 months time. And you can see that, a pretty good amount of patients, like 10% or more, having rating at more than 75% improvement of their eyebrow lifting. With patients, maybe get bias from like overrating, but this is the blind doctor's evaluation. And you can see that at 3 months, you can see like 25%, so 1/4 of the patients having at least 50% improvement. And you can see, I think this is something that can be seen by doctors. Anyway, there is also the limitation of the study because the number of patients is small. It's just only 34 patients. And since we asked the patient to come back, follow up at 6 months without doing anything, so we had 20% of dropout rate and no control group. So I recommend that there might be further studies conducting extended the duration for a year, or if we want to know more what it's done underneath the skin, you can go with the histological study with the effects of the macro focus ultrasound. So in conclusion, with the very first study, I find that macro focus ultrasound is safe and effective for upper eyebrow lifting. And you can get skin texture improvement as well if you wait up until 6 months. How about the other indication? So, we will not buy any machine and use it just only for one indication, right? That is why I mentioned before that I really like the characteristic of 2mm macro focus because it's already different from any brand in the market. So, Althera, they has only micro focus at 1.5, 3, and also 4.5. But you have something that is very characteristic from Ultraformer 3. So I explore another indication of MMFU because the 2mm, it might get into the level of the pores. So now we just finished the study on the enlarged pores, treating the patient only on the cheeks. And this is what we found. This is such a very early, and we hope to publish this study very soon because the result is good. So we bring in 31 Thai female aging between 25 to 50 years old and get just again one treatment session of macro focus ultrasound 2mm transducer. We treat them both cheek, pretty much around 200 lines for both cheeks. So 100, pretty much at 90 for each side. I will show you the protocol. This is the protocol and how we do it. So we do 30 by 3 passes shot here on both left and right. And averagely, we use the lines for 180, so 90 each side per one subject. And we measure pore volume and number of pores by using Antera 3-dimensional. And we again ask the patient and doctors to evaluate the improvement. And this is what we found. You can see that the volume of the pore is smaller. It's actually start to get smaller since a week. But you can see that, after a month, 3 months, and 6 months, the pore size continue to get smaller and smaller. Again, I feel regret that I did not follow them up longer than 6 months. But from what I believe, if you target something on the collagen, you need at least 6 months to evaluate the full effect of it. Again, the number of pore size as well, the number of pore, even it's smaller and the number is less. And you can see that after a month, up until 6 months, start seeing significant reduction of the number of the pores. And I can show you the photo, but to be honest with you, even at 6 months, the pores look smaller and less amount of number. But when you take a closer look on the Antera 3D, I think the maximum effect can be seen at 3 months, not at 6 months. Why? When we are aged, the enlarged pore is actually not because of the pore itself, but because of our skin. Like, we lost collagen, we lost hyaluronic acid. And I think we age over the period of 6 months. So that is why, I think this is not the only effects of recurrent, but we age and our skin quality, it's older. So that is why, for me, I think we might need, and here again, this is the examples of another patients. This is the clinical effects. And you can see at 3 months, the skin and the pore size looks good. But at 6 months, it might start coming back, that you might see it here and there. The patient definitely very happy. And you can see at 6 months, at least 6% of the patients still rate to have at least 75% improvement. The doctors, again, rating very good. And you can see that the longer you wait, the more effects you can see. So in conclusion wise, I think macro focus ultrasound again is safe and effective for treatment of the enlarged pore. However, for me, I think since it's different from the brown lifting and the skin at the cheek is thicker, I suggest that single treatment might not enough to produce longer lasting effects. So maybe maintenance as 3 months can be recommended. Or what you can do is you can do like, once a month for 3 months and then you can stop. So I think it depends on how you would like to tailor-made the protocol. How about something else? Again, we go from upper part of the face, cheek, and now we go to lower face treatment. We have to admit that Ultraformer is not the gold standard. It's not like our therapy that you can see ultrasound and then you can treat at the level that you are sure at the target level. Anyway, I try to use it. So I conducting the study, another study that already finished again. I'm not planning to publish this because I think, let me tell you, we got 28 subjects aged between 30 to 50 years old. We get again one treatment session, but with this time, we use submental and lower face treatment, but we use micro focus transducer. And that is how I'm going to tell you that how much I love the macro focus. So you can see that we use 3 and 4.5 mm transducer as recommended, like same as Althera. And this is the protocol. We treat the patient for 200 lines for lower face and submental area. And this is the protocol that we are using. So in this protocol, we just focus only on the submental. We did not treat any area on the neck. And average, we use 3 mm for 75 lines and 4.5 for 160 lines averagely. We use volume measurement camera to capture the improvement of volume on the nasolabial fold and jawline. And we also ask the patient and the doctor to grade the photograph and grade themselves. And you can see that I'm kind of disappointed when I see that, we did not see much of the volume improvement from three-dimensional analysis. No significant improvement. Again, there is another a jawline improvement. Okay, so and then when you see again at the jawline volume measurements, the jawline volume measurement cannot see significant by using the three-dimensional camera measuring. This is the photo, and for those of you who are not familiar, this is more like a geometric. So if you see the volume lifting or decreased volume, you will see the photo into yellow or red or orange. But see, it's still there and at the green or blue. So it's not reduction. So for me, I'm not really surprised. And you can see that, we can't really see much of the volume improvement in the patients. Again, this is the photo. To be honest, I'm not seeing much of the improvement. Maybe a bit of nasolabial fold, but is it enough to provide you the satisfaction? I'm not sure. Okay, here and there. Patient evaluation wise, you can see that, at 6 months, some of the patients were rated to not having seen anything or just only less than 25% improvement. With the doctors, like, most of the doctors rate not to, were rate to have, less improvement when comparing to the previous 2 studies. So, they see something, but is it significant enough? I think it can provide improvement subjectively, but not objectively, which means you see something, but it's just so, not good or great, not like upper eyelid lifting or pores. So for me, I think microfocus ultrasound is safe. However, the efficacy, as I mentioned, can demonstrate subjectively, not objectively. That is why For me, I think appropriate treatment protocol in terms of parameter setting, transducer use, or number of treatment should be applied. So, you need to adjust some protocol to increase efficacy of treatment. And I will tell you what is that at the end of the of the talk. But, before we go on to disadvantage, let me show you what is the advantage of Ultraformer machine. I think for me, as a doctors who use the machine and also as the patient who get treatment done regularly, I think the good thing and the advantage of Ultraformer is it's faster speed. So it's very fast. If you are busy doctors, you can't really spend 1 hour per each patient just to get lifting. So it's fast. Secondly, there is a wide variety of depth of the cartridge. There is different depth. Just only the face, there is already 4 depth, not counting the body. I'm not mentioning the body. User-friendly, but most of all, it's cost effectiveness. So, it's cheaper, it provides something to you. It start getting, you need to fine tune some protocol, but yes, it's cost effectiveness and it's less painful. So, the reason is because Ultraformer provide high peak power and less painful. So if you are getting it deeply, the patient feel less pain. And the reason is because they are used dual power board and better efficacy when comparing to any other machine. Again, 20,000 shot of cartridge or 30,000 shot of body cartridge. So, it's very cheap when comparing to other competitors, and wide variety. So you can target the different depth of the skin or the area treated more than any other machine in the market. And I think that is all the advantage of Ultraformer. So I'm not just only tell you what is the bad side of the machine, but I think this is something that you can improve the efficacy and treat safety without visualization. We know that the different thickness of the skin, there is already average thickness of the skin. And what we can see is on the upper part of the face, when comparing to the lower part of the face, the upper part of the face, the skin is thinner and this is thicker. That it might be the reason why you get better result with the upper part of the face when comparing to lower part of the face. Again, we had different relatively thickness of the skin, and that you might need to learn and see. But actually, there is one study that has been conducted by a good friend of mine, Gabriela Casabona, and Sebastian Cotofana. They study the depth of the distance between skin and also smash in all area on the face. Actually, they pay attention on the buccal, masseteric, and also submental on these 3 areas of lower face. And what they show me, it's something that is close to my heart. So, they study on the 150 patients, and the data categorized is not only by age, but also BMI. On the buccal, pre-masseter here, and also lateral neck, so it's here. And this area is the area that I cannot really get a good result from Ultraformer 3. And I will show you this is it. So, when you are looking at the people with different age, and when you cannot see the real depth or distance between skin and smash, what you need to learn is, the thickness of the skin is vary by age and also by size of the body. So when you are age, the skin is thinner, and you can see that with with same size of the body, you can see that, the skin is thinner when you age again. But what happened is, when you gain weight, the fat thickness is large, the thick is thicker. So which means the distance between skin and smash, it's wider. So you can see when comparing to the same age group, and if you are fat, the skin thickness is there. And when I look at these data and I look at to my study on lower part of the face, you can see that this is the level that I choose for the people who age between 20 to 50, remember? So here, No surprise, it's not fitting in 50% of my patients. So you know that when you are using microfocus ultrasound with 3 and 4.5 mm in that amount of patient, you have only 50% chance of hitting the right patient because you can't see it. Again, if the patient is fat, even less chance to hit SMAS, which means if you are using the protocol that the company gives you without thinking or without having other basic idea, you will miss the area that you can go. And the area that we know that most effective is SMAS, not the collagen. So with these, you are hitting only the collagen into the dermis. Again, premasseteric, so it's here. Premasseter, so it's around here. Same thing, in the same size of people, the older you get, the thinner your skins are. And with the same age, the fatter you are, the thicker of your skin. So which means if I use 3.5 and 3 and 4.5, I will get a very good result on the people only have the body mass index at more than 30. So in a very fat group, and you miss most of the patient in here. So that is why. So, getting more information, getting all that data in hands might be good for you if you decided to go with Ultraformer 3. Lastly, with lateral neck, again, we use only the 3.5, and you will miss it when you treat the patient who is higher body weight. See that? And there. So if I were to adapt this, I might get 4.5 transducer to treat the lateral neck in the patient who is fat. So which is something that you are doing different from the protocol that the company give it to you, but that might be needed if you want to increase the efficacy to your patient. Before I end this talk, I would like to remind you there is also contraindication for the patients, especially the one who had metal stent or electrical implant into the treatment area. So, or the open wound or hemorrhagic disorder. So, because the focus ultrasound is deep, and if you treat on the area that has vessels, it can also bruise the patient. And if the patient is on blood thinner medication, definitely the patient will bruise longer. So it's something that you need to tell the patient before. Again, precaution, sensitive area, hypertrophic scar, skin condition, autoimmune disease, skin cancer, anticoagulant, very important. And you need to inform the patient as well about potential side effects. Remember wound healing process. You got inflammation, swelling at the very beginning, redness, tender, bruise. You can ask the patient to touch the patient's skin and they can start feeling pain deep down inside. That is also normal. And if you are not doing it correctly, you can cause patient scar as well. Avoiding nerve. And I think this is the most common complication that I see from Ultraformer. So, there is already area that is very thin, and then you use two deep transducer on the face, and then it hit the nerve. And this is all the nerves that is very superficial. I'm not go over everything, but learn anatomy might be good for you, especially about nerve. If you are using high intensity focused ultrasound in treating patients, because you can get motor nerve paralysis. You can get palsy on perioral area. Forehead maybe less. I see more on the perioral area. Bruising, and again, you can get scar, white striation on the area that you treat too superficial. Let me show you one of the patients of me. You cannot see it when she doesn't speak, but let me show you in video. You can see asymmetrical mouth movement, and she had paralyzed because she come here and said that she had difficulty when she brushed her teeth, when she gurgled the water. Okay, let me show you photo, and you can see from the photo when comparing between two sides, and you can see that one side of the nerve, the function of the muscles, like there is a minor motor nerve palsy. This is happened after a few days after Ultraformer treatment. And so be careful of treating around the mouth, treating around the area around here. And, stay in safe zone on the area that nerve is very superficial. Last but not least, if you treat periorbitally, orbitally, HIFU can induce cataract. And this is the case, lawsuit case in Hong Kong. I got this news from one of my good friend, Stephanie Lam from Hong Kong. She shared with me this news. A female patients, 30 years old, receive HIFU treatment from a beautician. So, not a doctor. And they treat left upper eyelid, which is actually contraindication on the eyelid though. And she get painful with immediate blur vision and result in white spot of the lens like cataract. And she lost 10% of her vision. And this is the photo that she showed, and this is in the news of Hong Kong. And you can see that this is the white streak on the spot along the lens. And that is a scar, that is irreversible. There is no way you can fix it. Recently, we see one of the case posted, on the same thing, got HIFU treatment, and then you see can get the streak on the lens as well. So I think that is the HIFU induced cataract. So be careful of having this because, this is something that irreversible. In conclusion, I think macro focus ultrasound is very safe and effective for the treatment of upper eyelid and also enlarged pore. And I can see multiple potential indication in near future. However, micro focus ultrasound, from my study wise, can demonstrate only subjectively. But if you want to utilize your machine, your cartridge, and pick the very good and tailor-made protocol to the patient, you need to find the appropriate protocol, parameter setting, transducer use, number of treatment should be done to increase the efficacy of the treatment. And that's it. I will end this with my photo. This was taken 2 years apart, and you can see that I got eyebrow lifting from microfocus ultrasound. So that gives me brow shape and also lower face shaping for me. Thank you. There is one thing. There is one doctor get me direct message on that he missed the opening session of my lectures. There is the record. I'm not sure if the classes I know that classes record this lecture, but will you distribute it afterwards or what? I suggest you contact your local distributor in your country if you need the record. Okay, there is a question. Presentation email. Oh, I think that is something that you need to ask your local distributor or sales rep. The other question is, can HIFU worsening melasma? Actually, theoretically, no. But what it can induce is post-inflammatory hyperpigmentation if you are using inappropriate transducer and inappropriate setting, or if you are doing it not with the correct technique. So, even you are using the good transducer, but if you are not doing it perpendicularly, it will go too superficial, and that can cause heat on the skin, and that can cause post-inflammatory hyperpigmentation, which the patient can think as it worsening melasma, but actually in theory it's not worse. It not make melasma worse. There is a question on what is my opinion on the best protocol for upper face. I think what I like is what I telling you is I use the macro focus mode, because what I believe is, it's very superficial and thin skin. So the difference between thickness of the skin around the eye is less, no matter how old or how fat you are, because when you are fat, the area that is chubby is here, not here. So your weight has less effect on the thickness of the skin around here. So I think that is something that why we get better response or better result on using the machine on upper part of the face. How soon? The other question is how soon after thread lip can you do HIFU? If you are doing thread lift before, I'm not recommend you are doing HIFU immediately after thread lift, because thread lift can also cause inflammation. And when you get swelling of the skin, it's very difficult to determine the depth and difficult to choose transducer, and the patient may pain more and feel too much edema, or you create too much energy to the skin, and it can cause complication. For me, I rather spreading it out at least a month, but if it's good, I will wait for 3 months. And how about with the if you are doing HIFU first and then doing thread lift, I think it could be done in the same session if you are doing HIFU first. But again, doing too many things on the skin at the same session, and you know that if you are going for a very high or intense treatment, I might separate it. But you can wait just only a month, because after a month of HIFU, you can see the inflammation is subside. And now, after 3 weeks, you start seeing collagen stimulation. It would be able to do if you are putting thread lift after a month. Has it since a full face session with 2mm Pro? I think 2mm will be too superficial for the smash, especially on the skin that is thick with fatty cheek. I think you need something that is, so now for me, I have my own table that if I want to use the MMFU, I might look at the age and, body mass index, and estimate the depth. Or if I have, which I have Althera, I can just use the ultrasound function of Althera and pick the very good transducer if you want to combine with MMFU. Okay, HIFU induced cataract result only after upper eyelid treatment, right? I think it depends on how your technique is. So if you are going with brown lift, that is go below the orbit. It again, with the angle of your hands, if it's not perpendicular and aiming to the bone, I think you might get, I think you might be able to injure the patient's lens as well. So be careful. This happens not only with Ultraformer, any HIFU machine can cause it, even Althera. How do I handle the complication? So I think it's in my hands. I never had a patient with the nerve inflammation, but with the treatment of some of the referral cases, what I'm doing is I do the nerve test by using electrical nerve. Sometimes it can show conducting. So if it's less obstruction of the conducting, you can wait and see for 2 or 3 months. And it will be regain its own. There is one question on MMFU on hyperpigmented lesion. There is one study publication by using the other machine. I think it's published by my junior colleague that I love pretty much, Dr. Wasano from Thailand, for using it to improve melasma with the 1.5 mm transducer. I think it could be, but you have to look into the protocol because it's different machine. Okay, can patient do HIFU if she wear dental or bracelets? Yes, but I will avoid perioral area. I'm not doing it over because it's very sensitive. I'll go with lateral. And again, I think the one thing that why MMFU had more complication or nerve damage is because the protocol suggests you to try to treat wrinkle around the mouth. And I think that is the reason why. So if you stay 1 or 2 finger breadth behind the labial fold, it's very difficult to hurt the nerve around here. What kind of combination treatment with HIFU have you practiced? Recommend laser treatment, peelings? Yes, I do combination at all time. because when we age, there is a lot of problems going on. It's not only skin tightening, but I mainly use HIFU for skin tightening. If the patient has pigmented problem, definitely peelings or lasers. And if the patient has the problem of wrinkle and lines, I combine it with neuromodulator or fillers all the time. Silicone implant contraindicate? No, but I always tell the patient that since the silicone might get something to do with the macrophage and it might change the skin response. So the patient might not have the same effect or efficacy as other patients. So I think this is something that you need to consult the patient before. How long of the HIFU after dermal fillers? I think I might prefer doing HIFU before fillers. But if you already had fillers, I'll wait 2 or 3 months before. Rosacea patient, I never try, but I think it might not do, it cannot work. It might not making rosacea work, but it also not helping with any rosacea. Okay, there is a question from my Thai doctors writing the question in Thai. So the question is, patient can do HIFU after, I don't know what is the relaxes. I don't know what the treatment done, but if they are doing something like inside the lens, I might wait because it can create inflammation around the eyes. And inflammation around the eyes after surgery can last 3 months up. So I might wait. HIFU, PRP, I think it's totally different. Yeah, you can do it. You can do any combination, but doing it at the same session, I might not because it creates too much of the inflammation on the skin. Okay. One of the doctors tell me that he or she attend my toxin lecture. I believe it's a few days ago. And MMF, you can enhance that lifting effect. Yes. Again, how long after? I think I might do MMFU first and then do the toxin afterwards, rather than doing MMFU first. Okay, there's another question from Thai doctors about the BMI. Yes. The question is, if the patient who is fat, can we use like 6 mm transducer trying to get the treatment on the smash? I think it's challenging. Theoretically, it could be, but remember, 6 mm is at the level of nerve. You can also hurt the nerve, and you might not be very sure. So for me, I might like go with the ultrasound or a good reference before picking any of the non off-label transducer use. Is HIFU contraindicated in SLE? I think it's precaution. It's not really like contraindication, but it's precaution in the autoimmune patient. Some clinic use Ultraformer 3 for cellulite. I have no experience on that, so I really cannot comment. But in theory, cellulite is something that is, I believe it's secondary characteristic of female. So it will be there. You can't really treat it. You can just improve it for a while because it's like one of the female characters. So you see, no men has the cellulite. So I think you can improve it with any other machine, but it might not last that long. For the poor cases, which one you prefer? Doing once a month for 3 times or 1 in 3 months? I have no experience over so, but I believe from the study, it could be done both. I don't know. I haven't do any clinical study in comparison yet. but it's really work on pores. Should we prescribe any NSAID after HIFU if the patient has swelling? I think we can prescribe NSAID before treatment. So for me, I will put the numbing cream on the patient's face and then for 1 hour. And then after 1 hour, I give them NSAID and then wait another hour and then perform treatment. And that is very, very good. The question about nerve palsy, sometimes temporary, sometimes permanent, it depends on how much it injured. Can we treat patient with Jurgen syndrome? I think Jurgen syndrome has something with the collagen abnormal, and I don't think you should treat that. Autoimmune disease, SLE might be because the skin is normal, but Jurgen syndrome, I don't think you should treat. And mostly patient with Jurgen syndrome that not get much of the laxity though.